Good evening, Mayor, members of the council. I am Dr. Monica Anderson. I'm a native of Fort Worth, and I've been a Grand Prairie resident for about almost 3 years now. In February, I had the opportunity to meet with Mayor Jensen and discuss this information, and he suggested that I come before the full council, so here I am. I am a licensed doctor of dental surgery for over 31 years. I am a mom, a grandmother, a writer, and a 2-time cancer survivor. I love learning. But even with my background, I was surprised to learn that 9 of 10 accidental poisonings occur in the home. 20% of pediatric poisonings involve grandparents' medication, and 2/3 of teens who report abusing prescription drugs get it from the medicine cabinets of friends, family, and neighbors. As I learn more, I realize we're talking a lot about the opioid crisis, but we don't just have an opioid crisis. We have a larger poisoning, overdose, drug mix-up, self-medication, full-blown, over-the-counter, and prescription substance abuse and misuse crisis. Additionally, the EPA has warned that the drugs we're flushing down the sink, down the toilet, or throwing in our trash can end up in our drinking water source. To help combat these problems with the support of the American Dental Association's Institute for Diversity and Leadership, I've launched a project, Drop the Drugs, thus the shirt. It's an awareness campaign with 3 strategic priorities, and I'll leave some cards here with you, but it's based around prevention education for our beloved community of Grand Prairie, Texas. I've worked with healthcare providers to consolidate DEA, FDA, and EPA guidelines into an easy-to-use, very reader-friendly, user-friendly flyer for our citizens as well as for healthcare providers. I'll summarize what it says. One thing, the easiest thing is to decrease access to prescription drugs and over-the-counter medications in our homes. Don't leave them on the counter. Don't leave them where kids can easily get into them, teens, visitors, people working in the home. That's an easy way to decrease access. Prompt disposal of unneeded, unused, expired drugs immediately. We should clean out our drug cabinets regularly. And safe disposal of your drugs frequently at permanent, ongoing DEA-approved kiosks like we have here at the Grand Prairie Police Department in the Public Safety Building. There's also one in the Walgreens on Pioneer Parkway. A lot of people don't realize that. And I took the initiative a few months ago to reach out to CVS and ask why they didn't have one in one of their stores in Grand Prairie, and they've agreed to install one later this year at store 7421. If people aren't able to go into these facilities, they can go to DEATakeback.com, find one near them, or they can also get free mail-back, prescription mail-back envelopes from the National Safety Council. All of this is on our flyer. It's on our social media, on our website, Drop the Drugs. And my hope is to complement the ongoing efforts of the DEA and our wonderful police department. I know they're already doing this. They're working on, they have the 2 take-back days, which are promoted every year. Last year, 67,494 pounds of drugs were collected just in Texas. Over 300 pounds, according to Detective Becerra at the Grand Prairie location. That's in one day. President Trump, a lot of people don't realize, passed bipartisan legislation, H.R. 6, to combat opioid crisis with public health reforms. This is positive, real news. I just want to raise awareness that we've got one more solution to a very, very severe crisis. And imagine what would happen as this campaign grows and more people are aware that they can dispose of drugs at any time during the year. Why am I here? I'm here to ask for your support. I'll leave some of this information with you. I'd love to meet with any of you individually to discuss this more, and ultimately, I'd like a resolution of support from this council, from my hometown, so as I go forward with this pilot program, I can say that I have the backing of the Grand Prairie City Council. And my easiest ask is that you support us and share this information with your family and friends. Thank you very much.
Thank you.